Hi, hello there. How are you? Welcome to Dealing with Life. This video, I have devoted it to help you to understand borderline personality disorder, BPD. For many of us, living our lives, walking through our relationships, we not mayor. We not even know the reasons behind so many struggles, crazy makings with our relationships and close loved ones. And I am here to take your hand. And if you allow me, I will walk you to the river of solace while understanding what to do and how to defeat borderline personality disorders. Stay tuned. The first aspect that I would like to pinpoint in this video, the whole criteria or the diagnosis for this disorder. Oh, by the way, I'm a clinical professional counselor, and also I have been there. I know what you are going through, and I'm telling you, there is hope. I'm here to help. I have made one of the purposes of my life to help you, to support you, to beat this monster. I call it a monster. It is devastating. And most of us, we are walking out there without knowing what is it, what are we facing with, or how to adjust it. We're out there facing day-to-day life as competitive as already is without even knowing why is it that our peace is so difficult to maintain, not only with ourselves, which is the most important relationship that we hold up throughout our lives, but also with our loved one, our significant others. If you're a parent with your kids, with your teenagers, if you have a romantic relationship, you might be bouncing from relationship to relationship without knowing with certainty where is this all nightmare crazy making coming from. Here I am to help you. I am going to be presenting also the same information in my first language, Spanish. However, my two careers, my bachelor's in education, dual for special kids, teenagers, and regular typical children or students, and also my master's in psychology. I have completed both here in the state of Florida. However, as you could tell, evidently, my first language is not English, it's Spanish. I'm Cuban, born and raised in the island. And so I'm going to be presenting everything also in Spanish. And I'm not using AI to translate because sometimes the grammatical meaning of the words is lost in translation when we use any of the technologies advances that we have nowadays. And this is too much of an important and profound subjective topic to be neglected in that way. And as I mentioned, I have made the purpose of my life to help you if you are going to life with the relationships difficulties. Because most of the time, this crazy making is coming from developing traits of BPD or borderline personality disorder. Or it might be as well that you have been formally diagnosed with the whole criteria. The formal diagnosis only takes the 5 symptoms of the 9 symptoms of the criteria, which I'm going to present in this video. But please, please do not diagnose yourself. And also, diagnosis, it's only good to the extent that you know what to do with the label or the diagnosis. Diagnoses are good for insurance companies to pay for the sessions or the treatments. Diagnoses are also good because once you know the enemy, you know how to target it, how to beat that enemy. Nothing else. However, if you are not diagnosed by a clinical professional in mental health, you could be harming yourself and not necessarily helping you. Okay? All the videos I'm going to be presenting in this series are about to help you with your mental health. Specifically, BPD. Oh, by the way, Mariana, I am a professional clinical counselor certified in the state of Florida. I have been lucky enough to be trained by the best and seasoned professionals and supervisors in this field. On top of that, my former career before completing my master's in psychology in Nova Southeastern University. I was a certified teacher. I completed a dual program in the state of Florida as a professional educator to work with kids and teenagers, both mainstream and ESC students and typical regular students. We all know that we are human beings. We are not typical. Nobody's normal. We all know that if we are human, let's better get used to the idea that normalcy, it's overrated. We're just human. We are the same. However, during my years, more than 20 years as an educator in the state of Florida, working with teenagers and their families and their parents, it breaks my heart to witness firsthand the few and weak amount of information that we have been exposed relationship-wise. We are walking out there without knowing, blinded, like stumbling against each other's because we don't have the basic, the foundations. And it breaks my heart because now that I know better, I know that it is something, for example, during my years as a teacher, yes, the curriculum was teaching social studies, science, and math, reading, what have you. However, none of the classes, none of the hours were devoted or scheduled to explicitly teach our students social skills. And in my opinion, that is one of the reasons we are witnessing and seeing, sadly, so many devastating events nowadays among our youth. Now, if you allow me, I'm going to hold your hand and together we're going to be walking to the river of solace and relief. Stay tuned. Another reason that made one of the purposes of my life to put this information out there for you is the stigmatization involved with this disorder. BPD, or borderline personality disorder, is a very insidious disorder. That means that it might be very low in the spectrum. As a matter of fact, if you're human, you should have some of the traits in the middle or in the lower end of the spectrum of the BPD. People like you and me that are hovering in the middle of the spectrum or probably a little further up in the spectrum where we could meet the whole criteria for a diagnosis. We suffer, we struggle deeply, painfully through lives. I'm going to explain why. And we suffer double or triple when we finally get to the mindset, to the realization, oh, wait a minute, something's happening in here and here. This is not normal. I'm struggling. When we get to the mindset of seeking help, it is because most of the time we have gotten to the conclusion that it's catastrophic. I am having difficulties with everybody in my life. I am struggling in all of my departments. I am literally not understanding what is going on around me with people. And evidently, people are not understanding me as well. And what makes it even pervasive, people with borderline personality disorders sometimes are forced to bounce from therapy office to therapy office because it is a difficult condition to treat. It needs not only the formal training, but also the experience. And even better, if we have experienced this condition, this disorder, or some of their traits in their own lives. Now, what happens with this condition and makes it even sadder is that borderline personality disorder is, if not one of the most stigmatized diagnoses from the DSM-5, which stands for the Diagnostic and Statistical Manual of Mental Disorder. Okay, now I'm going to present you here with the whole criteria for the diagnosis. And I cannot extend enough the importance of please do not diagnose yourself. I'm going to walk you briefly through the 9 symptoms of the diagnosis to help you see up to what extent you're facing only some traits for you or your family members or your loved one. However, again, do not diagnose yourself. Look for help. Seek help from professionals in mental health. I am planning on opening my own practice maybe down this year by August. I'm still in the process of completing paperwork and logistic that really August this year, I'm going to be able to link down here in the description my contact information. So if you feel that you could be benefited from. So now take my hand and accompany me to fulfill my promise from this video, which are to explain to you the 9 symptoms that conform the whole criteria of that monster of BPD or borderline personality disorder. Let's go. Symptom number 1 of the 9 symptoms. It's a frantic effort to avoid real or imagined abandonment. And this is in reality the number one distinctive aspect of BPD. What is very interesting from this is that abandonment could be real from the environment. However, which is huge on this disorder or condition, it could be also imagined. I want to stop on this symptom because I believe this is the number one cause of this disorder. Imagine in our society where most parents are out there trying to provide for their households, sometimes working 2 jobs, sometimes continuing education or advancing their careers. And borderline personality disorder is a condition that usually starts developing in early childhood. Now, how much problematic is this in today's world, where you have a child that experience abandonment when parents are out there doing what they are supposed to be doing, providing for their family? It is so sad that that first symptom, that fear of abandonment, imagined or real, it also could be triggered by minor events, just like any of our friends saying that they are arriving late or leaving early, fears of abandonment and the betrayal, that distinctive characteristic of BPD. And what is most interesting about these symptoms, this is the same symptoms that bad people out there use to prey on individuals that suffer from BPD. Careful with that symptom. Symptom number, and this is one of the most pervasive symptoms where people start like getting into that mindset of seeking help. This symptom is symptom number 2, unstable and intense interpersonal relationships. Relationships alternate between idealization, oh, you are so perfect, and devaluation, you are just horrible. With symptom number 2, usually the individual experiences difficulties in maintaining stable and healthy connections. Symptom number 3, very common, especially in our youth, our teenagers, and young adults. Symptom number 3, identity disturbance, poorly defined or unstable self-image, frequent changes in goals, values, sexual identity, or career plans. Let's go to symptom number 4. Symptom number 4 is impulsivity in at least 2 self-damaging areas. This is symptom number 4, impulsivity in at least 2 self-damaging areas. It's one of the most dangerous symptoms of the entire criteria. Involves acting without thinking in areas like spending stress, risky sex, substance abuse, binge eating, reckless driving, and often leads to regret or negative consequences. Symptom number 5, it's definitely the most devastating of all. Number 5 entails recurrent suicidal behavior or self-mutilation. Includes suicidal threats, attempts, or self-harm, like cutting. Cutting is something very usual among this population, people presenting BPD. Most of the time, it does not represent a fatal threat to the life of the individual suffering from the condition. However, it might. So it's very important to take it seriously when it happens. And that will be another entire video. I will explain the purpose of coding for some individuals and what actions to follow. Symptom number 6. Symptom number 6. This is exactly the difference between borderline personality disorder and bipolar disorder. This is how a trained professional in mental health differentiate between BPD, borderline personality disorder, and bipolar disorder. For bipolar disorders, the mood swings happen not in one day. Usually they are not short-lived. They are longer, probably 1 or 2 weeks or more, depending on the type of bipolar disorder that the individual has. For individuals with a diagnosis of BPD or just few traits, those changes in emotions are rapid mood swings, often intense and short-lived. Our emotions change from happy to angry, sad, or anxious in hours or even minutes, often in response to external stressors or interpersonal triggers. This is another key difference between borderline personality disorder, BPD, and bipolar. The mood swings in bipolar are just out of the blue because the condition is totally related to biology. Very few trigger from the environment. Symptom number 7 of the BPD spectrum. Symptom number 7 is chronic feelings of emptiness. This is another very, very dangerous symptom of this diagnosis. A deep sense of inner void or numbness may feel like nothing matters or like they are just dead inside. This leads to attempts to pursue the wrong people. Doesn't matter if that people is unhealthy and should not be welcome in our lives. Substance abuses, reckless activities, addictions, you name it. Symptom number 8, and this is a symptom that most of the time us in trouble, inappropriate, intense anger, or difficulty controlling that anger. Frequent outbursts of rage, yelling, or even physical aggression may be totally disproportionate to the situation at hand, often followed by, guess what? Yes, that guilt and shame. This is the last symptom of the criteria, symptom number 9. Transient stress-related paranoid ideation or dissociation. Under stress, you may feel suspicious of others or disconnected from reality. That's dissociation. Paranoia, thinking others are plotting against you. And dissociation, feeling detached from one's body or surrounding. If you were watching yourself in a movie from the outside. Now, remember, we don't need to meet the 9 of these symptoms presented here to have a diagnosis of BPD. To have a full diagnosis, we only need to meet 5 of the symptoms here expressed. So, after having shared the 9 symptoms to blame for all the crazy making in our lives, you believe that some of these correlate, are familiar to you, please seek for help with a professional helper. Now, if you believe very few of the symptoms correlates or are relevant to your own specific situation, celebrate and share with those that you know are going to benefit from this. Pay attention to this. I want to be very adamant and clear on this particular. If you or your loved one, any of the traits or the symptoms of borderline personality disorder, you are at a huge risk of being abused by a person with narcissistic personality disorder. This is a symbiotic relationship, and I'm going to make a whole separate video for you. Please write that down in the comments. Any specific question that you might have on this particular. I will be more than happy to provide you with that answer and any other information that you might need on this. This is very important. Remember, this is abuse. And sometimes people suffering from borderline personality disorder or just some of their traits are victims of narcissistic abuse. One step at a time, take my hand. I will walk you to it breaks my heart. The profound stigmatization against borderline personality disorder. People out there, they are not well informed. They think that we are being too much or too difficult or just being manipulative. This couldn't be further from the truth. Very sad. And this is not only harmful, this is very dangerous. Sadly, the statistics show that from 80 to 70% of people suffering from BPD tend suicide at least once in their lives. And what is even sadder, 10% of these people actually commit the act. Please, do not label yourself, do not diagnose yourself or your loved ones with this information. If you think that any of your loved ones close to you meet any of these criteria, seek for professional help. And again, remember, choosing a professional going to guide you and support you through this journey is like shopping for the ideal pair of shoes. Try on a couple of them before making your final decision. Okay, remember, it's your mental health. You're literally putting your life or the loved ones in their hands. And from a kind place, one step at a time, we will get there. Remember, if you have any questions related to this topic or anything associated with mental health, ask me the question here below and I'll be there. I will give you my honest, not only professionally, but my personal experience with so much pain from mental health conditions. If by the end of this video, you get to the realization that it has nothing to do with you, that this criteria right now has very few points that collides with your difficulties with your relationships, congratulations. And please share this information with some of your family members, classmates, friends, acquaintances, people that you think that might benefit from this information. Thank you. Together, dealing with life, one step at a time. There is a light.